teachers should be alert on it. And when it comes to the teachers, I'm always telling, if a teacher has a child with the glasses, they have to have little extra care for the child. Maybe he will not cooperate as the normal child, you know, sometimes they get cornered because of that.
Yes.
She's wearing glasses and teacher is expecting them to do the same thing as the normal crowd. Sometimes you can maybe add 1 or 2 extra words, are you okay, do you hear me, do you see what I am doing, you know, just give him going, you know, for teachers. And children, let them have lot of activities outdoor, which is I always say,
Outdoor
because
activities.
yeah, in future we will have a big problem with vision and even hearing, because I see all the children, you know, they are just to get rid of the child, the mother, what they do is they just give a mobile phone or laptop
That's
or
it.
anything.
Technology.
Yeah, technology, and also give them earplugs. Of course, you are not, the child is not like those days, you know, when you check a child, they always want to, parents want to have the child to sit and wait. So always keep an eye on the child who like to sit and wait. Have an additional question from the child, ask why you don't go out and enjoy with them. Maybe that child cannot see. These things are very important, you know. Just have another, you know, plan B for the child. In case if he is always sitting and wait, or if he is always reading the books, just ask why you don't want to go and talk to them, why you don't want to go and play outside, you know, that sort of things. Just don't just wait, you're thinking, okay, my child is well behaved, he doesn't go, he doesn't move, he's well behaved, but don't think like that. There can be hidden conditions in him.
So what other things that a child can do to take care of their eyesight?
Well, a lot of green leaves and green vegetables, avoid junk food from the small age, you know, and always try and see the distance, like here in Seychelles we have more beaches, you know. Take your child to the beach, you know, let them enjoy rather than keeping them inside your house and maybe giving the laptop or giving TV games or something like that. Don't limit his vision only for the near work, which is happening is that now. Because parents doesn't realize when you are too much limited to the near work, they will lose the ability of seeing distance. So let them enjoy the distance vision, you know. Then automatically they'll be able to get the reading, the near work as well.
We were based on ABC vision. Can you elaborate a little bit on that?
Actually, children, when you take the children, we take A as attitude problem. So always these attitudes, the way child is behaving, maybe less cooperative and maybe doesn't want to stay in the place, those things can be like, you know, connected with vision or hearing problems. Yeah, and then the B is the behavioral. Again, B comes for the teachers, you know, how the child is behaving. Sometimes children are not, you know, how much ever the teacher is trying to take give something to the child, sometimes the child will not be cooperative. So always think there can be another side of the child, you know, behavioral, and also correction is most of the time the correction is possible. This is why we always say ABC for the parents, because correction is possible. Keep that in mind. At least up to some extent we can manage the thing without, if you bring the child on the correct time.
O que dela ko nou ti pe cause lo vision qui nous tout le temps basé là, nous appelle ça vision ABC. Par une voix, lo screen nous ti mettre ça ABC qui ça A pour l'attention et B stand for? B is for behavioral problem. Et C pour correction. Encore, on nous dit correction. It stand for correction.
Attention and attitude problem.
And attitude problem.
Yes. Attention is also, like we missed it before. Attention is also very important, because maybe the teacher is doing something in the board, the children behind is just, you know, doing some other thing. Maybe the child does not enjoy the board, he cannot see the board. So attention is also important.
So Dr. Kumari, before we end our interview this morning, our conversation, is there anything that you want to tell the people of Seychelles, the parents, the teachers, the children?
Yeah, mainly if you realize some issues, some conditions, immediately rush for the advice of a professional, you know, even hearing or vision or any other thing. Just don't wait for home remedies, or just don't be too positive on those things, you know, not to be so negative, but don't be too positive, you know, then you will miss it. So if you have some doubts, always get them to have routine eye checkups, And routine eye checkups also, like keep the records, which is very important. And children who are wearing glasses already, if you are going to various places for glasses, take the records at least. You may not need to come to the same place if you are not, maybe if you want to go for another place or change, you can go for, but at least the optometrist will able to see the history of it. So, these are the things we have to be careful and have an extra eye for the children, I would say, with all of this talk. So, if you have an extra eye about the children, you will be able to catch up a lot of things and before it's too late. I think that's our take home message.
Voilà, c'est celle un ton docteur Kumari Ratnayake qui te cause avec vous là bon matin, nous te cause vision pour bons enfants. Alors, si on n'a aucun doute si ou passé qui peut arriver avec vos enfants, ou capable de consulter docteur quand le chantier mall, grand floor, ou sinon capable consulter n'importe qui optometrist, pas nécessairement ça, mais seulement be vigilant, pareil, ingrédient, mettre LG extra là aux enfants pour connaître qui peut arriver, qui peut passer. Même si on a des petits coins là-bas, tout ça, il ne pas dire qu'ils sont behavior, qui est normal, mais tout le temps, il faudrait ou be vigilant, faire ci, essayer de suivre, mettre un petit peu d'effort en plus, essayer de suivre et get son comportement des oiseaux qui passent. Et là, s'il y a la nécessité, on va emmener un optometrist. Voilà, c'est celle, ça c'est Dr. Kumari Ratnayake. Dr. Kumari, thank you so much for today's interview. We were talking about vision of the children, Infinity Eye. So thank you so much, and I wish you all the best in Seychelles.
Thank you very much. Actually, it's a great pleasure to have a discussion today, and I think the message may have gone to the parents. This is my main target, it was. So I really thank you and your team for giving me an opportunity. Thank you very much.
Thank you. It's a pleasure. Have a nice day today.
Same to you.
Okay, I'll see you soon maybe.
Maybe for another session like this about
Why
a different
not?
measure. Yeah.
Okay, thank you.
Thank you.
Voilà, c'est celle, ça c'est une topic conversation.